Hello and welcome back to EduNest channel. Do you know that humans spend one third of their lives asleep? Yes, that's right. Sleep is an important, complex, vital process that helps our body to function properly. So today we are going to see about sleep, different stages of sleep, and we will also deal with some of the multiple choice questions that are related to sleep and their answers. So let us dive into the topic. So let us see a sleep cycle. The sleep consists of two basic states, rapid eye movement or REM sleep and non-rapid eye movement or NREM sleep. During sleep, the body cycles between NREM and REM sleep. Once asleep, a person goes through 4 to 6 NREM and REM sleep cycles. So let's go to a question. Which part of the hypothalamus is known as the master clock of the body, synchronizes the genetic clocks within individual cells, and regulates the 24-hour sleep-wake cycle or circadian rhythm? And the options are pineal gland, thalamus, suprachiasmatic nucleus, pituitary gland. So the correct answer is suprachiasmatic nucleus. Let us see the control areas of sleep-wake cycle in the brain. The sleep-wake cycle is regulated by brainstem and areas of forebrain like cerebral cortex, hypothalamus and thalamus. So the wake behavior is determined by the ascending reticular activating system in the brainstem, which activates the cerebral cortex. The cerebral cortex promotes alertness and attention. The sleep behavior is controlled by the sleep promoting neurons in the hypothalamus, which inhibit the ascending reticular activating system and promote sleep. Melatonin is a hormone from the pineal gland. It turns off the mechanisms that promote wakefulness. Let us move on to another question. Decreased levels of which neurotransmitter or its receptors leads to problems staying awake, a syndrome known as narcolepsy. And the options are serotonin, dopamine, GABA, orexin. So the correct answer is orexin or hypocretin. It is a neuropeptide found in the hypothalamus and it regulates the sleep-wake cycle. It plays an important role in keeping the pupil awake. Orexin inhibitors block the wake-promoting effects of orexin. Examples include suvorexant, lemborexant, daridorexant. So now let us see the neurotransmitters or peptides that affect the sleep-wake behavior. Glutamate, acetylcholine, norepinephrine, dopamine, histamine, serotonin, and orexin promote wake behavior, whereas sleep behavior is promoted by gamma aminobutyric acid or GABA, galanin, melatonin, adenosine, somatostatin, growth hormone releasing hormone, delta sleep inducing peptide, prostaglandins, and pro inflammatory cytokines. Now let us see another question. In Alzheimer's disease, which type of neurons in the forebrain, when lost, leads to sleep disturbances? And the options are serotonin neurons, GABA neurons, glutamate neurons, cholinergic neurons. And the answer is cholinergic neurons. Alzheimer's disease is a neurodegenerative disease that causes neuronal atrophy and loss of synapses, mainly in the cerebral cortex and hippocampus. Now let us move on to another question. In Parkinson's disease, which type of neurons in the ascending reticular activating system degenerate, leading to daytime sleepiness? And the options are serotonin neurons, GABA neurons, glutamate neurons, dopamine neurons. And the answer is dopamine neurons. The degeneration of wake promoting dopamine neurons in the ascending reticular activating system leads to daytime sleepiness. So the next question is, which of the following substances does not contribute to sleepiness and lethargy during an infection? And the options are interleukin 1, tumor necrosis factor, interleukin 6, orexin. And the answer is orexin. We have already seen that orexin promotes wake behavior and all other options mentioned are pro-inflammatory cytokines. Let us see the next question. What is the method that records the pattern of nighttime sleep using physiologic measures? And the options are electroencephalography or EEG, electrocardiography or ECG, computer tomography or CT, polysomnography or PSG. And the answer is polysomnography. Let us see the next question. Which of the following is not a measure recorded in polysomnography? And the options are heart rate with electrocardiography, muscle tone with electromyogram, eye movement with electrooculogram, brain activity with the electroencephalograph. The correct answer is heart rate with electrocardiography. So now let us see the next question. How long does each sleep cycle last in a person once they are asleep? The options are 30 to 60 minutes, 110 to 150 minutes, 150 to 180 minutes, 60 to 110 minutes. And the answer is 60 to 110 minutes. The next question is, which of the following is not a class of drugs used in the treatment of insomnia? And the options are benzodiazepines, orexin receptor antagonists, melatonin receptor agonists, aspirin. The answer is aspirin. The next question is, the first line drug for the management of insomnia is, and the options are benzodiazepine, benzodiazepine receptor agonists, orexin receptor antagonists, melatonin receptor agonists. And the answer is benzodiazepine receptor agonists. The next question is, benzodiazepine receptor like agents are commonly used in the treatment of insomnia. Which of the following is an example of this class of drugs? And the options are solpidem, ramelteon, suvorexant, fluoxetine. And the answer is solpidem. Now let us see the drug management of insomnia. The first line drug used in the management of insomnia is benzodiazepine receptor-like agents. So they act at the GABA receptors more selectively than the benzodiazepines. Examples include solpidem, saliprion, and esopiclone. These drugs bind to the postsynaptic neuronal benzodiazepine recognition sites and enhance the GABA activity at central GABA receptors. We have already seen that GABA promotes sleep behavior. Melatonin receptor agonists are other kind of drugs used in the treatment of insomnia, and examples include melatonin, ramelteon, and tasimelteon. The melatonin is produced usually during darkness and conveys a message of darkness to the central circadian clock located in the suprachiasmatic nucleus and induces night state-like physiological functions. Antidepressants are another kind of drug used in the treatment of insomnia, and those include amitriptyline, doxepin, mirtazapine, trazodone. These drugs are thought to affect the sleep by influencing the concentrations of neurotransmitters in the brain, such as dopamine, norepinephrine, serotonin, acetylcholine, and histamine. Benzodiazepines used in the treatment of insomnia include temazepam and triazolam. They act as a positive allosteric modulators on the GABA A receptor and increases the GABA levels. Antihistamines work by blocking the histamine receptors in the hypothalamus. Histamine is a wake-promoting neurotransmitter, and the examples of antihistamines include diphenhydramine, doxylamine, and hydroxyzine. Antipsychotics like quetiapine and olanzapine is also used in the treatment of insomnia, and they act by blocking the serotonin and histamine receptors. Benzodiazepine like triazolam is recommended for the sleep onset insomnia, while temazepam is used for both sleep onset and sleep maintenance insomnia. Let us go to the next question. What is the minimum duration for breathing cessation to be considered apnea? And the options are 5 seconds, 10 seconds, 15 seconds, 20 seconds. The answer is 10 seconds. Let us see the next question. The diagnosis of sleep apnea is based on the calculation of a certain index. What is the name of this index? And the options are apnea bradypnea index, sleep respiration index, apnea hypopnea index, sleep apnea index. The answer is apnea hypopnea index. Obstructive sleep apnea is a common sleeping disorder that is characterized by episodes of complete or partial collapse of the upper airway with an associated decrease in oxygen saturation or arousal from sleep. The apnea hypopnea index is the hourly average of apneic events or hypopneas of at least 10 seconds duration. OSA is defined as apnea-hypopnea index greater than 5 events per hour with a 3 to 4% decrease in oxygen saturation. Severe apnea can be associated with more than 30 to 50 apneic events per hour of sleep. The management of sleep apnea includes use of continuous positive airway pressure machine or CPAP machine. It applies a nasal or oral mask that is attached to a high-flow blower. The blower is adjusted to maintain enough positive pressure of 5 to 25 centimeters of water in the airway, which prevents airway collapse. Other modalities include uvulopalatopharyngeoplasty, genioglottal advancement and hyoid myotomy, radiofrequency ablation, which is the least invasive surgical intervention. Let us go to the next question. Which of the following medications are used in the treatment of periodic restless leg syndrome? And the options are clonazepam, valproic acid, selegiline, dopamine agonists, all of the above. The answer is all of the above. Periodic limb movement disorders is a rare sleep disorder characterized by periodic repetitive movements of the legs and feet during sleep. The drugs used in the management of periodic leg movement disorder are clonazepam, which improves the sleep quality, valproic acid, an anti-seizure drug that reduces the muscle activity, selegiline is a dopaminergic agent, Dopamine agonists like pramipexole and ropinirole. Dopaminergic agonists increase the dopamine levels, which regulate muscle movement. Another important sleep disorder is jet lag disorder. It occurs when a person travels across multiple time zones. The body's time and the environmental time are not synchronized. It occurs in person crossing at least 3 time zones. The resynchronization of the body's clock occurs 1 hour per day when traveling eastward and 1.5 hours per day when traveling westward. Another important sleep disorder is narcolepsy. It is a chronic neurologic disorder and there is brain's inability to regulate sleep-wake cycles. The person often go directly into REM sleep from wakefulness. It is of two types, with cataplexy type 1 and without cataplexy or type 2. Cataplexy is a brief and sudden loss of skeletal muscle tone, and there is destruction of neurons that make orexin. It is thought to be an autoimmune process. The first line drug used in the treatment of narcolepsy are modafinil and armodafinil. These are non-amphetamine wake promotion drugs. Let us go to the next question. Which of the following drug classes is most likely to cause nightmares? And the options are sedative hypnotics, beta-adrenergic antagonists, dopamine agonists, amphetamines, all of the above. The answer is all of the above. With this video, we have briefly completed some of the sleep disorders and dealt with some of the multiple choice questions related to the sleep disorders. I hope you like this video, and if you like this channel, please subscribe so that we will come up with new videos soon. Till then, thank you.